Today I wanted to do more like a frequently asked questions or an FYI type of conversation, because I feel like I get some of the same questions over and over again, and it's not bad. I mean, a lot of people are still like new to like natural medicine or a naturopath and what it means and what we do. And I mean, not all naturopaths are the same, and I guess it depends also where you live. Um, but I mean, I get interesting questions too, because it kind of makes me wonder what people think I do. And the best example, I had one lady sit down in my office and she looked around at the walls. She goes, "Do you believe in this stuff?" I'm like, what are you even asking me? Like, I always think of like the tooth fairy when people ask me if I believe in it. It's like, do I believe in vitamins? I'm like, sure. I mean, we need vitamins to live. Now they would be like, well, no, I mean taking vitamins, like taking like, don't you think your food has enough vitamins? Like, it should. Does it? I don't think it does. I don't think it does because of, I mean, not to get controversial, but we know that everything that's mass produced is not necessarily mass produced for quality. It tends to go towards quantity because they could sell more. And if we look at just any government's understanding of nutrition, sometimes it is nutrition for survival as opposed to thriving. And a lot of people are like, well, what? Like, explain that. So a lot of times recommended daily intakes are based on prevention of like diseases of malnutrition. So if you are getting 100% of your vitamin C from a glass of orange juice, it means that you won't have scurvy. I heard that. So do you think that that's enough? If someone says, well, just drink a glass of orange juice, that's enough vitamin C in the day. If you don't want scurvy, I mean, I'm saying it slightly tongue-in-cheek, but it is true. Now, I'm not suggesting you have 100 glasses of orange juice, but this now creates the question of why take a supplement? Why take a vitamin? There's the recommended intake, like a minimum for survival. And then there's things like what's called a therapeutic dosage, meaning, but if you take 1,000 milligrams of vitamin C, studies show that it helps reduce risk of infection and reduces viral contagion, and it helps you recover from respiratory infections faster, and it helps with a whole bunch of things in terms of healing and stamina and energy and adrenal function. Like if there's vitamin C is fantastic. So I'm suggesting that you wouldn't get all those benefits just from like a cup of orange juice. That cup of orange juice gives you just enough so that you're just okay. Taking a supplement, now that gives you access to all these other things available that a higher concentration of vitamin C in your body now provides the entire system. So again, people will be like, well, what if I eat a bunch of foods that have vitamin C in it? Well, that's better. I mean, it's always ideal. But who's to say how much of it you're actually therapeutically absorbing? Maybe, maybe not. Okay, well, the idea is your food doesn't necessarily give you the sufficient amount of vitamins that what we call a therapeutic dosage. Therapeutic dosage, think of it like if you take like one molecule of like aspirin, and then it's like, well, one molecule might, make the pain go away for a minute. But if you take 10 molecules of aspirin, the pain's going to be gone all day. It kind of makes sense. It's like, well, I mean, just one helps a little bit, but 10 times the amount does so much more. So that sort of analogy, it helps people understand why a supplement and certain vitamins can have a much bigger impact and benefit than just a dietary consumption. Again, the real backbone here is you have to have a good diet. And that's why any good naturopath, and practically all of them, I would say, they would definitely focus on a dietary change or assessment, at least to know that whatever you're consuming on a regular basis is at least creating a foundation and definitely not sabotaging the work that these supplements are trying to do. And then really the using the word supplement is accurate because you're just supplementing. You're adding on top of what's already there. Now with my patients, I like to investigate if they're actually digesting their food and if their food has the right balance and components of a balanced diet. I mean, we always think about carbs, fats, and proteins. And carbs get lots of attack, but at the same time, people just way overindulge in carbs, which is kind of ironic. And then there's people who kind of adopt the no carb effect, and that has some detriment as well. Or sometimes people just don't know what a balanced diet is, or they don't have time, or they do like a fake fasting. It's like, well, I don't really have breakfast, and sometimes I miss lunch, but I have a really, really good dinner. Then I have a bag of chips after dinner. So there's all kinds of just foundational things that are not happening. And as a naturopath, that's sort of like the first thing you got to look at. Like if you're going to see a naturopath, you have to be willing to make a couple positive changes. Most people recognize, like when I ask someone in their initial assessment, I'll be like, what's your diet like? And a lot of the times people will be like, it's not good. I'm like, oh, okay. Well, what is it? And then they kind of tell me a version of it. The worst things that you can do, in my opinion, is skip meals. I mean that. I know a lot of people like intermittent fasting. Most people, it's not for them, or they don't do it right. But well, that's another story. Most people don't have breakfast. A lot of people go way too long in between meals, so they skip meals. And a lot of people don't have protein in a sufficient amount. A lot of people don't have whole foods. They eat a lot of processed stuff. And anything that's processed, the nutritional value you got to think of as a tenth of what a whole food or something homemade would be like. That's sort of epidemic. The inability or unwillingness to cook. And we are in that state in society where nobody wants to prepare anything. Like it's almost like it's a bother to grocery shop, to prepare, to chop, to boil water, whatever, to cook, to spend the time, because it takes time. And if everyone's working or in school or busy, and we can just have something immediately come to our front door, that seems appealing, and it's okay sometimes. But on a daily basis, no one's really preparing meals. So food prepping and home cooking is really where it starts. Because if you don't have that, you could take the best vitamins, you're still going to be rotten inside. Yeah, people don't like that. Okay. Look at that hair. Good stuff. Stop it. Close enough. Okay, well, this is part 2 of my frequently asked questions. A sidetrack already. Homeopath and a naturopath. I used to get that a lot more. I haven't been getting that as often. I think there's just fewer homeopaths in general. I mean, 20 years ago, homeopaths and naturopaths are kind of like one or the other. A homeopath, I think it's kind of like one of those, it's like the term Kleenex. Like you sort of like call every tissue Kleenex, but it's it's like you're using the word homeopath as someone who does like natural therapies and stuff. But it's more accurately, at least in Canada or Ontario, homeopath is someone who practices exclusively homeopathy, which is dilution therapy. They use those little pellets. And that's all they do mostly. Like that's sort of their niche. I mean, a homeopath can practice other modalities. Whereas a naturopath, I mean, yeah, we learn homeopathy, but that's just like one of all our tools and modalities that we use. So it's different scope of practice. It's kind of not really the same thing anymore, or never was, but less and less similar. So that's a sidetrack. Testing. One of the big things that naturopaths do are specialty tests. And we're used to going to our medical doctor and getting some blood work. Sometimes we'll do a urine test. Sometimes we'll go to a specialist to do some kind of imaging or like some type of interesting test, like a colonoscopy, for example. That's a test. The tests that we do are a little bit more looking at levels of things that aren't commonly looked at. I like to make a very broad statement that your medical doctor is just trying to make sure that you're not dying today. I mean, that's oversimplification. Hospitals do that. Emergency rooms do that. Your medical doctor might just want to make sure that you're okay for the short term, long term, but they're not looking. They would just want to make sure that there's nothing glaringly desperate that you don't have to go to the hospital today. So they do blood work. They want to make sure that you don't have diabetes, that you don't have high cholesterol, that you don't have like some kind of serious malfunction going on, which is good. Naturopaths do more what's called subclinical work or preclinical, meaning we want to see the trend of something before it gets to the point where it is evolving into a disease. Your family doctor will probably say the same thing, but their threshold is a little bit more narrow. They'll be like, hey, you know what? In 6 months, you might need a transfusion. Whereas we'd be like, 2 years ago, you're like, your iron's getting low. We should be supplementing. It's a little bit of a simple oversimplification, but kind of proves the point still. The one test that a lot of people ask me about, and even amongst the naturopaths, there's some controversy, is food sensitivity testing. I think it gets bashed because there's a lot of motivation behind not liking the test. I think part of it has to do with not knowing how to interpret it properly. And also maybe not a completely clear understanding of what food sensitivities are, or what are they real? How are they different than an allergy? And a sensitivity is a different group of antibodies that are not acting acutely. They act subacutely, which means they can act within a day, 2 days, 3 days, or have a unclear expression, meaning they are not having a sensitivity to a food, and you're consuming that food, your reaction may not be what is to be expected, like some kind of digestive upset. Sometimes it's skin. Sometimes it's mood or energy. Sometimes it's a fever. And that's more along the lines of some controversy, because it's unclear the mechanism. To me, I understand it because I've seen it. I've seen it so many times. And that's why I am a huge proponent of food sensitivity testing, and also knowing how to interpret the results with like a keen eye. And you can't do a cookie cutter approach. I was talking to some naturopaths last week. I brought up my favorite test, food sensitivity test. And I mentioned that like sometimes it's one food that is causing chaos for everything else in your gut and everything else on your menu. And with some experience, you can identify what that might be just based on the results. Sometimes people have just one or two things that are really elevated. Sometimes they have 50. And I get that report. You see all these foods in red. Sometimes it's like, yeah, there's work to be done. It's not just sensitivities. These people just have a failure at every level of digestion. And they wouldn't know it unless they did the test, because someone's coming in for the most common one was eczema when I was kind of just starting out. Someone had eczema, automatically it's a food sensitivity test. And a lot of the times they'll be like, but I don't see a connection. Or they'll be like, I cut out dairy for like 2 weeks and nothing changed. It's not enough. So, and it's not just to cut out food. I mean, it's one thing to be reacting to a food, to have a sensitivity. It doesn't mean that it's necessarily an allergy. It doesn't mean that it's necessarily forever. But sometimes you got to just make sure that you put the fire out before you start reintroducing things. Meaning, cutting a food out for 2 weeks slightly puts a dent into the inflammation and damage that's there. And there's other tests that can confirm that. I mean, we do stool analysis that looks at bacterial load, parasitology, but also inflammatory markers. And that's also helpful to see when someone's just got chronic gut compromise, and now whenever they eat, their food is just not getting broken down. There's other tests. My hair is bothering me. I gotta stop looking at it. There's Dutch hormone testing, which I really like as well. And this is where naturopaths, they kind of separate themselves from standard practitioners or doctors, because we do look at the kind of like the chemical reactions, the breakdown byproducts, the chemistry behind our hormones. It's not enough just to have a peek at the likely culprits. You can't just look at estrogen and progesterone on a blood test and be like, oh, this is why you're hemorrhaging every month. It's not enough information. And on a medical doctor level, they're unlikely to use different techniques. They're probably going to use either birth control, or they might give you tranexamic acid to stop the bleeding, or they'll just do a hysterectomy. Simple. Some really, really cool doctors, they might do hormone replacement, which may or may not be right. But then naturopaths, we like to do all kinds of stuff. We can do acupuncture. We can do herbal formulations. We can do dietary. We can do supplements. So with the increased options that we have, it makes sense that we use tests that give us more variables to look at and evaluate, because then that's going to influence what we give you. I like it. What else do naturopaths do? Some naturopaths do hokey things. I've been accused of doing a few hokey things. And by hokey, it's usually stuff that you hear about on the internet, or you have some weird friend that's like, oh, you got to try this. Ion foot detox, for example, that comes to mind. I don't even know if I want to talk about it, because I actually think that there is benefit to it. It's really not what is being advertised, though. Like, if you put your feet in water, like a hot bath that has electrodes and salt, you have to add salt, and you run that array for 30, 40 minutes, the water goes from clear to mud, like just bad. And it's being advertised that all the toxins are getting pulled out of your body. That might be like a grossly oversimplification or misdirection. Does ion foot detox help anyone? I've seen it help people, but it's not doing what it's the advertised explanation. And I think that's why it loses credibility, because it just does not seem scientific at all. I mean, it seems like, what's next? Like, what are you going to do? Like, I don't know. It's like magic, but it's not. If you listen to anyone who talks about the body as like a battery, and like we have like a polar charge, like our head can be, I don't know if it's positive or negative or whatnot. Like we have like a dipole. So whenever we can ground ourselves or add an avenue to stimulate a charge, this has an effect chemically on our cells. And I've seen it. I've seen it also in live blood analysis. I've seen where people can have like a momentary change in blood flow and blood dynamics because something in terms of polarity or pH has shifted. So these are things that are based on chemistry. I don't know if I'm going to include this in the video. But yes, I think that there's some things that naturopaths do that, like even homeopathy isn't scientific in terms of like how it works, at least not our science. Yeah, I mean, people say science is science, but I've seen homeopathic remedies work. Now, but in terms of what a homeopathic remedy is, it's a sugar pill. There's nothing there, theoretically. It's such a gross dilution that there's nothing left of the initial material, but somehow gives some kind of effect of the initial material. I think with being a naturopath, you have to be willing to know there's some things that just, it's hard to explain. It's not because it's false. I don't think that our science is just there yet. I don't think the understanding of it is. I think there's some things in nature that are a little bit invisible. And we kind of have to make our best guess of understanding why it's like that. But we can't because we don't know yet. But we can only look at the effect and cause and effect. If you give someone something and it has an effect, change something. I don't think saying it's a placebo is an answer. Because you can give someone not the right remedy and it won't have a benefit. You change the remedy, now they have a benefit. What happened to the placebo? Wasn't there the first time around? What other crazy things do naturopaths do? Answer a lot of silly questions. That's okay. People want to learn. I think some people want to know, if I take a supplement, do I have to take this for life? Probably not. I'd hope not. Again, the idea of a supplement is that it's performing a function and addressing a deficiency or correcting something. So if you... Hello? Let's say you lack stomach acid and I prescribe you betaine, HCl. So you take betaine and you'll take probably 2 capsules before each meal and you'll do that religiously for about 6 weeks. Inevitably, people start to forget occasionally, or they'll just miss it, or they just won't have it with them, or they forgot it, or whatever. After those 6 weeks, they'll find that it's still helping them, but they find that they don't need it as much. They'll be like, well, I actually ate like a steak and I forgot my HCl, but I felt fine. I didn't feel like I did in the past. And the idea there is that the HCl is actually helping stimulate and correct the lack of stomach acid production. And then in the future, what they do is they use it as needed. So a person who has a predisposition to a low stomach acid, when they use betaine, they eventually get to a point where they can moderate their usage, or like PRN, use as needed, which is ideal. Because I think that most supplements, they can be phased in and out as needed. And when you start with a naturopath, usually you get this prescription list of all these supplements you got to take. the goal is always to like whittle them down to like almost nothing, or just have them kind of like a medicine cabinet idea where it's like, you have this, you know how to use it. When you need it, go to it. And that's where, the doctor as teacher is one of the tenets of naturopaths. So we have to like educate our patients so that they know how to use something when needed, and not to become like a slave to supplements, where they're just like, oh, I go out. And people come in with like grocery bags of supplements. Half of them are expired. Half of them, I don't even know where they bought. A lot of them are like Costco or grocery store brands that are like, don't eat this. I don't know what that. And then there's like some really, really good ones, but probably don't hit the mark, because when people go to the store to buy a supplement, their instinct is to like buy a supplement that addresses a symptom, which isn't wrong. But what happens when you have like 4 different symptoms? You're going to have 4 different supplements. And if you understood that some of these symptoms are kind of coming from the same place, maybe you're not addressing the deficiency or the root cause, and you're just treating the symptom. Treating the symptom reduces the symptom momentarily, but then it comes back. So the root cause idea is like having an understanding and with experience of like, where are these symptoms evolving from? Is there a common root? And if we address that root, does it get rid of all those symptoms? So sometimes in the beginning, you need both. You want symptom relief, but you also want to address the root cause. And another thing that they'll say is like, well, I know naturopathic stuff takes long to work. It doesn't. It takes long to work if you're only addressing the root cause. And some people are like purists. It's like, well, I don't want you taking don't put an ointment on your skin, but we're going to fix your gut, which is going to help your immune system, and it's going to relieve the skin irritation. Well, your skin is going to be blistered for a while. I mean, maybe using a skin cream to calm it down, remove some of the symptoms, but working internally, well, I mean, that kind of works well together. So I like that. Sometimes I like something for symptoms, but then the root cause is being addressed. What else? Sip of coffee. A lot of people, they kind of already presume that I'm gonna take them off gluten and dairy. And they're not wrong, because I mean, I've heard people be like, oh, this is just like, where did this gluten and dairy thing come from? Well, it came from people realizing that those foods are making up a bulk of their diet, and it's bothering their stomach. And when they remove those foods for a period of time, their symptoms get better. That's where it came from. And then over these decades, the medical system has kind of caught up in a sense where a gluten sensitivity, they sort of interpret as more only of it as like a celiac disease. And then same thing with dairy. It's probably lactose intolerance, which is not a correct term. It's not even what's really happening. Or there's another term that they came up with. It's like an acronym where it's like you just vomit when you have dairy. And it's like kind of like an allergy. So there is science behind it. There's medical understanding behind it. But the truth is here, if you want to get off gluten and dairy, you're just going to start feeling better. And it does help a lot of your symptoms. That doesn't mean that you have to be off it forever. And then there's the other idea of like naturopaths give people detoxes. And I don't necessarily, at least I don't think of them as a detox. Because I tell people detoxes are for healthy people. Now, sometimes people want to lose weight. And they're like, well, I'm going to do a cleanse. I'm going to start over. I'm going to feel good. I'm going to get on a good track. It's not bad. It's not, I encourage that. But it's not like hosing down your driveway. And you're like, okay, it's all clean now. Because, I mean, within a week, it's going to be dirty again. And our organs, they do detoxify themselves. Now, if you ask your doctor that, your medical doctor, they'll be like, that's crazy. and they'll be like, excuse me. They'll say it's nothing that you have to do consciously. Your body cleanses itself. And for the most part, that's kind of true. But sometimes things become sluggish. And the one organ that we pick on the most for that is the liver. So you go to any practitioner, any naturopath, they're always going to say it's your liver. It's so easy. It's like saying it's it's stress. Stress is causing this, and your liver is doing this. And take all these supplements. That is, like, if you had to put like a microcosm of what a naturopath would say, I mean, that probably would be like, cut out gluten and dairy. You have your stress levels, and you have your liver. It sounds silly. It's not, and it's not totally inaccurate, but it just sounds like it way oversimplification. So some people do feel better when they do a liver detox. But what is a liver detox? There's so many different ones, but most of the times these are herbal formulations or certain vitamins that enhance phase 1 and phase 2 of detoxification. These are chemical pathways that are happening in the liver. And sometimes our nutrition is a bottleneck for the supply of these resources that the liver is looking for. And when you take in these nutritional components, your detox pathways become upregulated. They start working more effectively. The outcome is usually some weight loss, an improvement in organ function, like organ system. So digestion is better, going to the washroom, better, more energy, less sluggishness, less hormonal issues, skin looks better. So there is an impact. I think people just maybe, there's so many catchphrases and there's so much a disconnect of like what, you cleanse your liver. What does that do? I mean, there is an abundance of clinical research and studies that explain what phase 1, phase 2, the different markers of regulation and detox and how they're influenced and what they do clinically. But we're just so like disconnected from it because, to be honest, I'm not going to explain necessarily to a patient, it's like, well, your phase 2 detox is backed up. They're going to be like, what? And they're like, I'm constipated. I'm like, exactly. So there's a little bit of a disconnect with the layman's terms and the science and the ability to explain. Like, we do spend a lot of time explaining, but sometimes can't be like a chemistry lesson every time people come in. And to be honest, I don't even pay so much attention to the minutia. A lot of times, it is sort of like, I know the symptoms. Yeah, the liver is involved. There's some people who are very, very clinically inclined that they want to know. No, I want to know exactly which enzyme's not being up. Why is it being impacted? Bless your heart. Patient just wants to feel better. I just want to make sure I'm giving them the right thing. And they get results. So sometimes the lack of understanding or lack of clarity is just because things are very, very, very clinical, very, very particular and specific. And some people value that. The average person, it's over their head, which is okay. Photos. Oh my gosh. So many people are obsessed with poop on social media. So I saw one naturopath. She had like a bowl, like a bowl of fruit, but it wasn't. It was a bowl of all the different types of shapes of poop. And she was just like, well, this, and if yours looks like, I don't like that. And leave the poop talk for you guys. I mean, it's important, but I had one person text me a picture of their poop. I'm like, you could just describe it. Would have been fine. People, they're like, I want you to have all the information you need. I'm like, this was TMI. this is crossing a line. I actually think that that might be illegal. Of them, not me. I didn't do anything. I'm like, I just sent you a text. I'm like, okay, cool. I'm like, why? Delete. Block. All right. I want to say more things. More things that come to mind. When people come to naturopaths, what do they ask? Oh, sometimes they ask about schooling, which is that's actually a very reasonable question. They're like, is this a weekend course? And I think they have those, but you're not really recognized as a naturopath. It's a 4-year degree after university, which is good because it takes about 4 years to learn all this stuff and to have a sufficient clinical experience, because last year is mostly clinical, like you're working under a supervisor, seeing patients, still doing courses, but there's a lot of rigor in terms of the body, understanding it, diagnostics, pharmacology. So you got to be able to speak the language because we're in a MD prioritized system. So you got to be able to collaborate with them and understand them. So it makes sense that it is a very established program and it's not easy to get in. You got to have a very good, strong background in the sciences, or at least it helps. And yeah, and you have continuing education, which is also useful. Yeah, so you can't just be anybody and be like, yeah, I'm a naturopath. I've had people be like, yeah, I'm a naturopath. I'm like, you don't look familiar. And then they're like, yeah, no, I went over there. I'm like, oh, okay, that's fine, whatever. As long as you're in your scope, it's fine with me. Calling yourself a naturopath, I mean, I don't know if you can, there's probably regulations about inappropriate use of the title, because we have title protection, which is very important. Oh, let me pause.